Welcome back to TMI Talk with Dr. Mary. I'm your host, Dr. Mary, and today we're going to be talking all things scoliosis. This is a widely misunderstood diagnosis that many people struggle with, and there's a lot of misinformation out there, even in the physical therapy realm. And so I wanted to bring on somebody who specializes in this. And today I brought in Dr. Meghan Teed. She's a physical therapist who specializes in scoliosis. She also has a podcast called Ahead of the Curve, and she owns Mindful Movement Physical Therapy and Pilates and offers in-person and virtual services. And in this episode, we're going to be talking about common myths around scoliosis, what can be done to help with scoliosis, how physical therapy specifically focused on scoliosis is different than traditional physical therapy, how hormones and stress can play a role, when to consider surgery, how different phases of our life can potentially affect scoliosis, such as during pregnancy or during perimenopause. And a lot of people with scoliosis tend to be put within a heel lift. And so sometimes that can actually worsen symptoms. And so when to use a heel lift or when not to. And then finally, understanding how the nervous system can be involved. So not forcing specific movements, maybe that your spine is not necessarily ready for. And then how to discern between what's real and what's not out there with all of the information on the internet. So, without further ado, we're going to jump into the episode, and I hope you enjoy it as much as I did.
Ready to tackle the topics that you've been curious about but never felt comfortable asking? With a straightforward, no-nonsense perspective on life, blended with candid stories and a healthy dose of humor, Dr. Mary Grimberg cuts through the fluff and addresses the conversations we all need to have on TMI Talk, where no subject is too taboo. Our bodies, our minds, and everything in between. Now here's your host, Dr. Mary.
Welcome to the podcast, Megan. Happy to have you on again.
Thank you. It's good to be here.
Yeah.
The last time I was on was over a year, at least, I think.
Probably because I took that little hiatus, like 9 months or so. So I think it's been over a year and a half or something like that. And we talked more about pregnancy. And so today I wanted to dive in more to a lot of the common questions about scoliosis.
Sounds good.
So
Great.
cool. Well, jumping right in, what are there's so many myths about scoliosis, and I'm sure you're busting those every day, left and right, like karate chopping them. So explain to me, what are like the most common myths that you hear, and then what's kind of reality from it?
I think one of the most common myths I hear is there's nothing you can do about scoliosis. You basically have to live with your situation or get surgery. You're not really given any other options. And obviously I wouldn't have a job or a business if that was true. Every day, even in my own body, I have scoliosis, and I am always like seeing changes in my own body through the work that I'm doing, and other people are experiencing that themselves. So that's probably the biggest myth that I encounter. And I mean, there's so many. How many do you want me to list?
Just give me like your most common ones,
Okay.
because
Yeah.
for people that are listening, oh, I guess it would be if you are listening, you're the people that are listening. So anyways, in physical therapy school, we didn't talk about scoliosis, and we weren't taught on pelvic floor dysfunction. So the training that Meg and I have had to do on our, specializations have had to be outside of PT school. And so what, even as a physical therapist, like, I know the basics about scoliosis and can guide people, but, you're in it and doing this every single day. So, what are some other things? I know that I've even heard I shadowed a physician once years and years ago who was a pediatric orthopedist, and they were telling people that scoliosis can't cause pain.
Yeah, that is another one.
I was like, wait, what? And I was a young little PT, so I didn't question this orthopedic surgeon, but I'm like, oh, that's bullshit. But anyways, I
Yeah,
just
and can
couldn't
you
believe
imagine
that.
being a person that has scoliosis and you have a bunch of pain and you're told that over and over again? It's like, it's insane to me. How can you even like look at a spine shape like that and think that that person wouldn't experience pain because of the asymmetries and different loading, the compression areas? I mean, obviously they're going to cause some discomfort in your body, even if it's not like extreme debilitating pain.
Yeah, I mean, I couldn't believe it. I mean, think about it in any other body part. If somebody's ankle was like completely rolled in and they're walking on the inside of their foot and you go up to them and you're like, that doesn't hurt. Like you're telling them it
Yep.
doesn't hurt, you know? And sometimes there are cases where people you can look at them structurally and be like, "Ooh, are they in pain?" They look like they're in pain and they're not for
Yeah,
some
that is
reason. But that's a rarity though. But any of these blanket statements, I think in medicine just like really tick me off because I'm like, then there's medicine is science, so it's constantly evolving. And so there's no absolutes, there's a lot of high probability. We can guess basically based on a specific data set of a specific population, but that doesn't, always translate.
right.
And there's nothing in medicine that's like 100%, you know?
Mhm.
So,
Yeah. One of the unfortunate myths is that scoliosis can't progress beyond adolescence. Um,
mm,
is a myth. It can progress again during pregnancy and then once again in menopause. Those are the two most common times that it can progress again, and that's usually because of hormone changes and shifts in those levels during those times. So you have a period of rapid growth during adolescence. So that's why that's one time that it can progress and change a lot. And then during pregnancy, obviously you have relaxin that plays a major role in things. You can use that to your advantage, though, during pregnancy, that things are more mobile and able to shift. But if you don't understand your curve or understand anything about scoliosis, you wouldn't know how to take advantage of that. And then the final time is during menopause. So um, there's a lot more research, thankfully, being done about menopause and just about the genetic factors that influence scoliosis. So hopefully there will be ways that we can like just take some additional supplements or change the way that our eating habits are that will help with changing the progression.
well, what kind of leading into that? So I treat a lot of people in perimenopause. And so, they're listening to this and what what can they do to learn more about their curve and their curve type? Because it can be daunting to know where to go and who to talk to. Obviously, they can follow your social media as well, and we'll tag you in this so they can reach out and look into your programs. But where can they start? Because I think more the fear is a lot around pregnancy too. But I mean, if they're because of similar hormone changes and stuff like that, or we know that, how can they learn? Like, say if I know I have scoliosis and I have no idea what type of curve I have no idea that this was even an option. Like, where could they go? Like, where could they start?
Mhm. I would say looking locally is a good idea, doing a little search and seeing if you do have any physical therapists who specialize in scoliosis local to you. One thing to be wary of is just going to a PT clinic and asking if they treat scoliosis or know how to treat it, because everybody will say that they do. A lot of the times that will happen. So look for specialized training in scoliosis, like the Schroth method, Pilates for scoliosis, things like that. Um, that would be the first avenue I would go if I were looking for help. And then if you're not seeing anybody local to you that is certified or has any extra training, then I would kind of take that next step and go online and do some searches that way. So um, I I would avoid going on like Google and YouTube and doing general searches about scoliosis because that can get a little bit scary. So I mean, you can do that, but then look at, who is writing that article or blog post about what to do about scoliosis because it's not always reputable.
Yeah, it's discernment. I feel like there's so many people that can put stuff out there now. I've seen a lot of people that are apparently pelvic health specialists and they're not, and there's no medical degrees. And some of the stuff might they be saying might be okay, but it's like we're in an era right now where there's a lot of misinformation. I don't know if you've been seeing like some of these there's like three different documentaries. I mean, this is kind of like a deflection of it, but it was like three different documentaries on people faking cancer. I don't know if you've
Yes,
seen
I was just
this.
looking to watch that. It was like apple cider vinegar was one or
I
something.
just saw that one, and then there's another one called Scamanda or something, and
Okay.
she fakes the cancer that I had, and I was like, oh my God, didn't know you could monetize that. That's crazy. Like that you would even do that. But then they've set up like these protocols and stuff, or I don't know exactly what it is, but I think a lot of people were believing them and following them. And just because somebody has a lot of followers, like
Yeah,
sometimes that does
it does
not,
not translate. Yeah.
you can also buy followers. I don't know if people know that. You can buy them, you can buy comments, you can buy likes. So there's a lot of information, misinformation that can be out there. So looking to see if people are medically qualified, what their degrees are, whether it's physical therapist or chiropractor or physician or things like that, that they have a license as well.
Yeah. Yeah, and I would say when you are reading the information, make sure that it's not just like these black and white statements, sweeping statements, like all or nothing type of things, because that's usually false.
I think
Because
that, yeah, that's for most things, I feel like.
there's
But yeah,
so much
these,
variability person to person, and um, yeah, any medical condition is not just a black or white type of situation.
or the sweeping statements like, my program will change your life. And I actually, oh my gosh, I was just at the gym this morning. It was like, lose 15 pounds in 30 days. And I was like, you guys, it is 2025. Like, it is 2025. Like, the world's on fire, and you're telling people to lose weight in 15 pounds in 30 days. It's like, if you're doing that, it's all water.
Right.
And it's just,
All going to come back, unfortunately.
yeah, if it sounds too good to be true, it probably is. It probably is. And hey, I've seen a lot of people make drastic progress in my practice, and I'm sure you've seen the same, but it took time and it took effort and it took like a continuous process of doing that. So any of the sweeping statements, have you seen any like in particular, like specific ones like, hey, your spine will be straight in 5 days if you do these?
Yeah. Well, it's
Oh
like,
no.
oh yeah. Oh yeah.
Ugh.
And there's a lot of braces out there that say that it's going to straighten your scoliosis. And if anything, I mean, it'll weaken you because you're not using your muscular strength to support yourself. So you're relying upon that external support. And I think if anything, it worsens the situation if you're wearing it all day, every day. Um, but that, and yeah, there are people out there. There's, I don't know how legit this is, but there's like some sort of machine thing that people go and they use that. There's this guy that used like a mathematical formula for their scoliosis. And I'm like, I don't know enough to say yes or no about it, but to have results happen in um like a week or two is pretty unbelievable. And if you do get results, I don't think that they're going to stick.
Hmm.
You're getting them that fast.
You know, it's hard. So many people ask me about different things. They'll be like, "What do you think about this gadget or that gadget?" And I'm like, I literally, I can't keep up. Like, I can't. And I am, if something works, like, let's see if it stands the test of time. Like, I am all about it. But there's so many gimmicky things that I've seen over the years. Like, even just in pelvic floor physical therapy, it's like, hey, I saw something posted the other day. This person was like, program's better than in-person PT. And I'm like, you just put down the entire profession. Like, be careful, like, and if somebody's putting down an entire profession, and I mean, hey, there's good and bad PTs, there's good and bad every profession. And so, but to blanket, like, put your whole profession down, that's also something to consider. And so like this is the discernment part of like deciding like who do I want to listen to? Do you resonate with their marketing? Is it very fear-based? Does it seem too good to be true? I think those are some big ways to kind of discern
Mhm.
like, hey, is this person right for me and is it not? Because when you're in pain and you're scared, you're vulnerable. And when you're vulnerable, that's when
Yeah.
it can be
You can't get
easily taken advantage of. Yeah.
there.
Yeah. The amount of things I've been seeing about like, this will help strengthen your pelvic floor and do all these things. I'm like, the issue is that we're so stressed that our asses are tight. Like, it is just,
It's so true. And that's the case with scoliosis too. I mean,
yeah.
you're having so much tension and stress in your life and in your body. It's going to perpetuate the things that are already tight and wound up. It's going to make them worse.
Hmm. I never cease to amaze you, probably. Uh, yeah, so with that, I mean, you kind of jumped into the braces and stuff. So when would somebody want to use a brace? And following that, when is it time to consider surgery? When should somebody consider a brace and or surgery?
In adolescence, it's a very critical time to take action with that. Um, Between the degrees of, I think they're bracing a lot earlier now than they used to. So, meaning it's not quite as severe of a degree. So 25 now is about the degree that they'll start bracing adolescent people. And there's all sorts of different braces out there. Usually a firm brace is what's going to be the most beneficial, firm brace that's three-dimensional. There are some braces that kind of turn you into a pancake, and they just kind of flatten everything out and they don't allow for the derotation to happen, the opening to happen, and the maintenance of the kyphosis and lordosis of the middle and lower back. So just like the side curvature, you want to maintain that as best as you can, because that will create other pain problems down the line if you flatten out those areas.
So wait, so some of them are only front and back,
Mhm.
even though the scoliosis is literally side to side. Oh,
Mhm.
interesting. This is why it's important when these gadgets and these things is to
Yeah,
see because I mean, how would that straighten? That would only help somebody's upright posture. It wouldn't help the curvature.
right. Yeah.
It makes sense.
And yeah, so that that can be problematic, and even not putting your brace on correctly can be problematic too. So like if you don't have it tight enough, your curve is going to try to escape wherever those openings are. And that's a good thing if the openings are in the correct positions, but if they're not in the right spots, then it can make things a little bit more tricky. And then for an adult who is looking for a brace or curious if a brace will be helpful for them, I generally recommend those if you are a person who can't stand for prolonged periods of time, get your housework done without excruciating back pain, and it's really limiting you that way. I would use that kind of as like a little supplement extra crutch where you put it on when you're doing stuff like that. But wearing that all day, every day, that ends up again kind of taking the root of a little bit of a downward effect because it restricts your rib mobility and your ability to breathe and expand the rib cage. And then that just increases your anxiety and increases your pain levels.
I mean, that makes sense. It's for pelvic floor dysfunction. If somebody has prolapse, I mean, it's to a lesser degree, but
Mhm.
of the spine, like a smaller version of bracing, but basically a pessary will go into the vagina and hold the vaginal wall. And it's the same thing. It's like, well, it's not like people wear these all day, every day, so it's a bit different, but sometimes people just need to put it in for a specific activity. And then, like, so if they want to weight train or something like that, they can put it in and then take it out or whatever the activity is. So, yeah, that makes sense. Where can they get a brace? Like, where do you find them?
The adolescents, they need to go to an orthotist and have one
Like
specially made.
custom?
Mhm. They do that for adults now. Align is a good company to look for if they have them in your area. They are throughout the country. Um, and yeah, they do custom braces. And then for adults, you could just, go on Amazon and get, a supportive brace that way, and that would be sufficient for that. Like you could even just get like a lumbar support type of brace for something like that. It doesn't have to be a special custom made one.
Cool. Good to know. When
Mhm.
should someone consider surgery?
So definitely a delicate topic for people. Like you mentioned with your brothers, if this is a person who's in adolescence and their curve is quickly progressing, that's a time that I would be considering surgery. If um, they are 55 degrees and beyond, that's usually the route in adolescence that is recommended to stabilize the curve and make sure it doesn't continue to progress. That's because, on average, if you aren't doing anything to help your scoliosis, if you're just living your life and you're a teen and your curve is at 55 or more, on average, that curve is going to progress 1 degree per year. So it ends up becoming a problem later in life. And then you might not be a candidate for surgery by the time, it's really causing you a problem.
Yeah, I think in I don't know if people are aware of like why like people need surgery too. It's in the case of my brothers, like it was their curve was so bad, and again, it was a progressive disease, but it's like you can do all the strengthening and they don't have the muscle capacity to do it. So theirs it was like a must, but the compression of like their internal organs and not able to fully expand and contract. So like in a difficulty breathing and things like that can make a difference.
Yeah.
So if somebody is, say somebody's going through perimenopause right now, right? So say they're going through it and they hear this and or pregnancy. We've also had that episode in the first season if you guys want to check that out. But what are some precautions or things that they could work on now? So we talked about going to somebody local. You can kind of see, not just like a generic PT clinic or anywhere that says like somebody that specializes in scoliosis. But what would that look like? So say if somebody wanted to come in and be preventative of that, Could you give them an idea of what that might look like? Obviously, each practitioner might be a little bit different, but I'm sure there's some
Yeah.
common themes.
So during that first session, no matter the reason why you're there to address your scoliosis, you kind of go through a standard assessment with that person. We take a look at things like your rib expansion, your lung capacity, just getting some baseline measurements for that. The rotation that you have of the spine. So that means when you bend forward and you reach for your toes, that's the prominence that you see pushing out into the skin. So we assess that because that can actually improve with exercise specialized for your curve. And we take strength and balance measurements, baseline photos. And that one, that can be a challenge for people to see their backs because who holds a mirror or like takes photos of their backs. So a lot of people haven't seen their own back and maybe ever. Um, so that can be kind of a hard thing to walk through during that first visit. But it is important to have an understanding of where you're starting from and having that awareness so that you can begin to make some changes.
Yeah, it's one of those things I feel like there's just like this delicate balance, probably of not scaring people, but also like they're need just making them aware, but also empowered, but also not like, hey, like this is fine. I feel like I struggle with that sometimes in healthcare is like, hey, how much to get people concerned, but not so much that they're just panicking. And so I find that that's a delicate balance when it's something can be severe.
Mhm. And I'm going to throw this out there that sometimes if you go to a scoliosis specialist who doesn't have scoliosis, it can be hard. It um it can feel um a little bit like a personal attack at times because that person has a symmetrical spine and then they're analyzing like all of these things that you're doing wrong, um, the way that you're holding yourself, it can be really challenging. I actually just had a client of mine who's a PT. She has severe scoliosis and she went to training, had a horrific experience where she was the only person in the group that had scoliosis and she just felt like nitpicked the entire time. And, the instructor was like looking at the way that she was like picking up her backpack or carrying her backpack and like raised her eyebrows at her. And she's like, that's awfully heavy, isn't it? And she's like, this is my course material and my laptop. I'm not like a fragile piece of veal. I like to snowboard. She likes to snowboard. She's a Pilates instructor. She's a very active person. So she was like, I'm really grateful that I worked with you before I went into that experience because, you know, you understand. And then you also like kind of prepared me for a lot of what I went through during that time. So, um, yeah, I don't know how to take that or how
Well,
to take it a different one, but
I think it's important to note, I think every condition can be a little bit different. I know that I've heard people say with pelvic floor PT, like, hey, I don't want a PT that hasn't had a child. And obviously it's different, right? But like that kind of was a dagger into my heart because I struggled with infertility and after cancer, I'm just like, I'm good. I'm not having kids. But when you're actively in infertility and you hear people say that, it's like, oh
yeah.
man, like that's a dagger just because I didn't have a child. Meanwhile, I do see though how it's different with scoliosis because it's like, scoliosis isn't necessarily like some people accidentally get pregnant, but some people choose to get pregnant too, right? So there's in that, and
Yeah.
it's, a 9-month period versus like, scoliosis is a lifetime. And so I could totally see how that I think it's just the lack of being trauma informed, to be honest. I
For sure.
think that we have an issue in healthcare where it's so easy to do that. I mean, even in pelvic floor training, right? We'll do pelvic floor assessments and people start talking about somebody's vagina literally in front of their face and be like, well, this, I feel this and this. And then you're like, is there something wrong with my vagina? Oh God, I can't even, my vagina's not even right.
Even have a vagina that's correct.
What's going on? And I've heard the instructors be like, you guys have to be careful. These are people that we're working with here, even though I think for some reason when you take these trainings, people just think like, oh, everybody's fine. Like we're all practitioners. No, we're all human beings with heightened emotions right now because there's a lot going on in the world and everybody's processing a lot right now. And so add on any criticism and it's not, yeah, that's not great.
No. And I think it's exactly what you said in that non trauma informed is super important. And also there's nuance to what you learn in a continuing education course. You can't just copy and paste with each person the material that you learned. You have to use your critical thinking brain and think, okay, neutral spine isn't sustainable to maintain the entire course of the day, which that's what you're taught in a lot of these scoliosis specific courses is neutral spine all the time. So what happens when that person wants to go and play their sport or go dance ballet, do something they love? Are you going to sit there and tell them that they can't do that anymore? Because that is a lie. And, that's going to make things worse because the more inactive you are, the more that scoliosis is likely to progress.
Yeah, it's a balance because it's like I do think sometimes actually when I when I learned dry needling like 13 years ago, the instructors were very
Seems like
like
a long time ago.
yeah, I started
Like
needling
the
like
first
right.
person
I was like I
that
invented it. I just took the needle and just started no. I think like because I'd moved to Austin 2011 and took the training at the end of 20, well, it was beginning of 2013. So I guess it was 12 years. Maybe I lied. So yeah, needling for 12 years. But the first training I took, they were like, just stab the muscle until it stops contracting. That's what they said. Like, just put the needle in and keep going until the contraction stops. And when I started doing that, I was like, everyone's flaring the fuck up right now and they're blaming me. And I'm not, I'm a
yeah.
new grad, right? So I'm listening to what I'm supposed to be doing. But then I go, no, 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 no. So I toned it back and was like, no, I'm going to go into the muscle, get the twitch. How do they feel? Great. Okay, next area. I'm more gentle with it, but I had to kind of distill what I had learned about how does that actually translate into practice? Right? You can needle somebody over and over, but that's just going to cause the same issue. You're just retightening the muscle again versus sticking a needle in it and allowing it to contract and relax. But sometimes yeah, it's interesting when you go to these trainings and stuff too.
Yeah.
I went to a trauma healing training about somatic healing a few months ago, and it was not trauma informed at all. And I was like, this is
Crazy to me.
That's a big thing too, is sometimes the trainings are not trauma informed, which if people are getting into trauma to help people with trauma, they've probably been traumatized themselves in some capacity. So then they're working through their own stuff so they can hold space for somebody else. And so, yeah, that's interesting. I just went on a ramble.
No, it's okay. Yeah. It was all connected.
It is because, well, it's like it sounds like scoliosis, like it sounds a bit more like pelvic floor physical therapy too. And it is very intimate and it's very, feeling aligned with your practitioner, feeling like you can talk to them and you're not being judged. And if you feel like there's that, maybe some open communication and seeing, but, and seeing
Yeah.
how they react.
And that's the tricky thing because there aren't very many specialists. So it's almost like you get what you get and you're trying to find somebody in person. Unless you're in a big city, you don't really have that many choices. But
There's not many in Austin either. I'm thinking like the next PT, so I'm hiring somebody in the next few months, and the next person I think after that, I'm going to see if we can get somebody that does scoliosis because I think there's only like one or two people in Austin.
that's crazy.
I mean, I don't know. I haven't necessarily looked recently, but last time I looked, it wasn't that much. But I do think that there is a lot of the public might feel like it's too good to be true.
Right.
Do you find that too?
I kind of, it's definitely more the older generation that is that way, where
Because they were told that.
they're told that and they're not as, I don't think they do. I don't want to make a sweeping statement about that because I have plenty of people who are in an older generation who do their research, but I just feel like they are more likely to take what their doctor says at face value and not question it. Whereas our generation, we're like, yeah, no, I'm going to, if I don't like what I hear from my doctor, I'm going to continue to search for an answer that suits my life and suits my goals a little bit better.
Yeah, it was a different time. My parents are like that. It's like you have to. That's the discernment too. It's like, okay, that's one person's opinion, and now who else can you go to? And so it's yeah, it's definitely interesting how each generation has, handles their health in different ways because something it wasn't acceptable even back then to challenge your doctor. It's not like you need to challenge them and be an asshole about it. It's just like, hey, what are the other options,
Yeah.
And
Hmm.
seeing that. So one of the other things that I've found and want to know your opinion of this is I've seen some emerging evidence on how potentially low progesterone can cause scoliosis. What are your thoughts on that? And like, yeah, just tell me what you think about all that.
Yeah. So I just actually did an interview with someone, his name is Dr. Mark Morningstar, and he's doing a lot of research on genetic components and factors that influence the development of scoliosis. And there's two genes that came up over and over again for being a higher likelihood of developing scoliosis, and that's I'm going to mess it
MTH, it's MTHFR or something.
Yep,
Yeah.
MTHFR and COMT. Um, and both of those influence, like if you have those genes expressing themselves on that person, then they have a higher likelihood of developing scoliosis and that scoliosis progressing. So what he was talking about, and I'm like really terrible with a lot of this stuff, like remembering like the different um
Genetic and
genetic
hormones and
components.
yeah.
Yeah. Yes.
It's a whole, I had to bring somebody on
Yeah.
to explain like estrogen dominance because I was like, I need you to break this down so then and then tell, people because this isn't I can help people with the symptoms, but this is a whole nother realm, right?
Yeah. And it had more to do with melatonin and with estrogen.
Oh,
Uh,
okay.
so being lower in those two things, lower in melatonin and actually I think higher in estrogen. So I don't know if that works inversely with progesterone.
Oh, okay. Wait. So they have high estrogen and low melatonin?
Definitely low melatonin, and I can't remember what it was for estrogen. I can't remember if it was high or low for that.
Okay.
Um,
Yeah. Well, have you seen anything on progesterone?
I've I've not.
Okay.
Um, that doesn't mean it isn't a thing.
No, I was just wondering because you and I have talked previously about this and how like there's a there hasn't been anything necessarily linking the two, but childhood trauma, repeated trauma while we're developing, and a link between scoliosis. And I just wondered, have you seen that? You've seen that pretty consistently?
I've seen consistently that and or having a very dominant parental figure. Usually it's a mother figure.
Really? Oh, interesting. Well, just on the reason I brought up progesterone too is because when in our estrogen dominance episode that we talked about how when under chronic stress, the body prioritizes, so it goes down the similar pathway. The body prioritizes making cortisol, so the stress hormone, over progesterone. And so I was just wondering, like, as in childhood, so say that like the repeated exposure to chronic stress, maybe we thought it was normal at the time, right? I was just thinking, like, I wonder if there's a correlation between the two. And I did do a little research and I saw some stuff popping up, but there wasn't anything linking the two. And I think because we just don't know as much about hormones as we thought, and I think that there's just a massive amount of research that still needs to be done in understanding how hormones affect these symptoms. But it's
Yeah.
just, what are some other correlations that you've seen?
A higher incidence of people developing scoliosis with certain sports like gymnastics and ballet or dance. That's usually, I think it's more of a causation type of thing than not a causation, correlation. So people who are naturally bendy, probably have connective tissue stuff going on. They're more likely to go into those things to begin with. So if you have that, and then you have also the predisposition to developing scoliosis, I think it's just the combination of all of that together. Um, but there's no proven thing that says that dance or gymnastics causes scoliosis.
Yeah, yeah. And like I said, there's nothing correlating necessarily the progesterone.
Mhm.
I saw preliminary studies, but I just thought that was interesting because then I added on the link of, okay, how much of this? Because I just see, I'm just down this whole path of like understanding how, genetics can be expressed, right? There's one piece, but some people can still have the genetic factors but not express things.
Right,
And in the study that in the research I've been doing but with trauma and like needing help processing it and getting out of the constant fight or flight, I've seen that those are like, say we have two people with the genetic factors, right? So I've heard them use the example of smoking, right? Not everybody that smokes cigarettes gets lung cancer.
right,
There's
right,
there's a high correlation, but if one person has smoked cigarettes and they have like a supportive partner and their family and they have great communication and support system, and then you have somebody else over here that smokes and is isolated or maybe has dealt with significant trauma that they need help processing and understanding how to move through it, this person's more likely to express it. And so there's just stuff coming out about, okay, well, why in genetics some people have stuff and others don't, right? Because there's multiple factors. And so
yeah,
I just think it's interesting to kind of start looking into all of that. And that's not to like say, oh, your childhood trauma like caused scoliosis. It's just more of understanding like, hey, how much the body processes trauma and like what can we do to kind of help with that too. And so learning about the nervous system and things like that. Like you said, if you're chronically in fight or flight too, you're going to be kind of like tight and hunched over. And so how much of it is more that?
right, right. And you're internally winding yourself up.
Hmm.
You're trying to protect yourself and guarding from whatever that trauma is.
There's a commonality here, and maybe there's not research on it yet, but it is interesting to start observing those things.
Yeah.
So what what are your thoughts on, okay, so if somebody's listening to this and they're like, hey, I have scoliosis and it's not that bad, but how are exercises for scoliosis different than kind of like generic PT
Mhm.
exercises?
Scoliosis exercises will take into consideration what your curve is doing. So when you're going for generic PT, if you go in, usually you have to have some sort of symptom or pain in order to get there. So they'll give you generic low back pain exercises or shoulder or neck, like wherever you're having that pain point. And that PT won't do an assessment of your curve first. That's with generic PT. With a scoliosis specialist, they're going to educate you about your curve, what your tendencies are in standing and sitting, that are potentially feeding those asymmetries that you have baseline. And then they'll teach you strategies for countering those asymmetries. What I found to be super important that I've made a tweak and adjustment on and through the training that I've done with scoliosis is instead of right away trying to force that person into a different shape than they currently are in, we need that permission from the nervous system first to actually make those changes and adjustments. Because if you go in and you start forcing things and you don't have that permission, then that's when it can create even more pain if you have it baseline. And it can create pain if you don't have it baseline. I had somebody who went and she's an adult and she wanted to go to the specialists and do an intensive. They do the adult bracing, and it was, just like very forceful exercises. The brace was like really shoving her into corrected alignment. And she came away from that in excruciating pain, and she didn't have pain to begin with. So, we have to be smart about how we're implementing these things and understand that the person has been in this shape for however long. It needs to be more of a slow and steady process first. Take a look at areas of restriction all throughout the body and see how you can teach that person to release those areas independently without your hands on them. Give them those tools to heal themselves, and then begin working on slowly but surely implementing the corrective stuff later.
I like how you brought that the nervous system up with that too, because it's like kind of what you were saying. If you have a practitioner that you feel like there's just it doesn't feel right, maybe they're not understanding or you just feel something's off, right? Your muscles are going to be tight as well. And then forcing somebody into something. I mean, I've even seen it just from like a lighter degree of like even when you put like a heel lift in somebody, they'll put in like a heel lift right away, like something drastic. And I'm like, you cannot, you've had that. This is why I have an issue sometimes with, and I have a question with leg length for you. But say somebody doesn't have scoliosis and they're immediately put in a heel lift. I'm like, well, if you haven't had pain for 40 years and then all of a sudden you have back pain now, I'm not going to put a heel lift in you. If you've had pain your entire life, and this is just ongoing, I'm like, let's consider this. Let's try it, right? Because sometimes it also can be muscular tightness as well. But even so, even if it's just a little bit and then they go and wear it all day, they flare up.
Mm.
So it's like a little bit kind of at a time. It's like new shoes, right?
Yeah,
So what are your thoughts on um why can't I get my words out? Heel lifts.
heel lifts. Yeah, they are definitely overprescribed with scoliosis, and you want to make sure that that person actually has a true leg length discrepancy and difference. Most people with scoliosis, it appears like we have two different lengths of legs, but in reality, that's not the case. It's the rotation of the pelvis, it's tightness in the tissues that are kind of pulling the innominate up into the torso and causing that to appear like there is a difference. So actually taking a true measurement and seeing, hey, does this person have a leg length difference or not? And then if they do actually have a difference, starting with as small of a heel lift as possible, like you said, little insert, like just a generic Dr. Scholl's thing that you slip in and see how they respond to that and see if that actually helps to balance things out. But usually it's not a true leg length discrepancy.
For those people that don't know, gold standard of a leg length is going to be the standing x-ray, but nobody really does that. So you measure, well, the PT or healthcare practitioner, chiropractor, or whoever you're working with. It's the part that you can feel on the sides of your hips, like right in the front, and then you measure it all the way down to the top of your inner ankle, that little bone right there. And you can at least get an idea of that, even if it's just a little bit, but it will look like you have a leg length, but it's actually the curvature of your spine. So in essence, if you did put a heel lift in there, wouldn't it just reinforce the curve more?
Yeah.
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 So you want to be careful with those as well. So yeah, well, if you want to, well, I'll just kind of summarize a little bit of what we said today, and then I'd love to, have people know your services. So, what we really went over today is, the common myths about scoliosis, when someone should consider surgery, understanding like when to use a brace in childhood or in adolescence versus adulthood, how finding the right practitioner is important, not, finding somebody that's scoliosis specific, and how sometimes it can be that being careful with a certain practitioner because it can feel like there's potentially judgment or forcing things faster than they need to be. But that can be hard because there's not a ton of scoliosis specialists. And so in that, just learning more about your curve so that way you can understand and help prevent progression. And then we talked about some potential associations, things that we've noticed that's not necessarily confirmed in the research, but just something to be aware of with hormones and how that can affect it, and leg length discrepancy, and how not just everybody getting a heel lift for that, and then easing into the exercise because this is going to take time. Actually, before I jump into that, you did say that before you jump into your contact info, you did say that every year it progresses like 1%. And so have you seen that it kind of halts and stays where the curve was when if they continue with more scoliosis specific stuff, and have you seen that reverse at all?
Yeah, so definitely a higher likelihood of that halting, the uneven loading of the spine, and there is a chance that it can reverse. I've seen it reverse like about 5 degrees for adults on average. As long as that person doesn't have osteoporosis, usually that's another indication that things are going to continue to progress if you're not addressing that as well.
Gotcha. Yeah. And there's a lot of stuff you can do for osteoporosis too now, and understanding even just beyond medications, just understanding how to weight lift, diet, a variety of different things. I'll have to have one of the PTs that specialize in osteoporosis, but with a lot of the research too is around like loading joints and getting us stronger. So that way the bones get that input of, hey, we need to build more bone.
Yep.
So, if you want to tell everybody where they can find you, about your podcast, and then your upcoming programs.
Sure. Yeah. You can find me. I have a podcast called Ahead of the Curve that's on Apple, all the different podcaster apps. And I have a YouTube channel that is also called, no, it's called The Scoliotherapist, but I have my podcast on there as well called Ahead of the Curve. And you can find me on Instagram. I'm the Scoliotherapist there. I am currently closed for my program for the Scoliosis Strength Collective, but the doors are opening fairly soon for that. And I have a free training coming up. I don't know if this will be released before or after that, but it is March 9th and March 13th. It's called the Curve Lengthening Lab, where I teach you how to safely lengthen your scoliosis and your curves without increasing your pain.
I love that. This won't be out by then, but will they be able to access that? Like, will you have it?
It'll happen again in the
Okay.
fall.
So
So yeah.
basically getting on your email list to kind of learn of all the upcoming things.
Yeah.
So yeah, you have a wealth of knowledge on your podcast. So highly recommend if you all want to find out more about scoliosis in depth and ways to help. So thank you so much, Meg.
Thanks for having me, Mary. Good to be back.
You've been listening to TMI Talk with your host, Dr. Mary Grimberg. Make sure to subscribe wherever you get your podcasts. To learn more about Dr. Mary, head on over to drmarygrimberg.com. And make sure to follow Dr. Mary at Dr. Mary PT on all social channels. To learn more about Dr. Mary's integrative practice for pain relief in Austin, Texas, head on over to resilient-rx.com. Thanks for listening.